Hi, hello, welcome back. Now, if you ask this question, which is one of the hardest modules or hardest subtests when it comes to OET, many candidates would have this answer that listening is really tough. Now, why is it so? One reason can be the multitasking that it demands, like you have to track the audio, you have to run your eyes through the questions, understand the question, and you need to mark the answers. A lot of things happening simultaneously. That can be a reason. And in listening, specifically part C of listening is thought as one of the challenging parts by many of the students. Why is it so? What is it actually happening in part C? What kind of questions you get in part C? Why is it so challenging? And how can we actually tackle this? Let's find out answer to these questions in this video. Now let's understand the format of listening part C. So you hear two audio recordings in part C of listening, and the duration of each recording is 4 to 5 minutes. It is similar to part A. In part A also we had two audio recordings, each extending for about 4 to 5 minutes. Now what you hear in part C, the kind of audio, it will either be a presentation or an interview. Now in part A what we heard was healthcare consultation. That is a conversation happening between a patient and a healthcare professional. But unlike that, in part C, what you hear is a presentation or an interview. So what presentation or interview, I'll tell you. What you hear is the type of audio is professional development type audios. That is, a healthcare professional would be talking about a research or a study he has conducted, his views, his opinion, his experiences, all of this would be shared. Either it can be in the form of an interview, where an interviewer would be asking questions to the healthcare professional, or the healthcare professional would be presenting it. It will be like a monologue. So what you need to understand is the format about the format of part C. You will have two audio recordings. Either both of these can be presentations or interview, or it can be one presentation or one interview. And the kind of audio, the type of audio that you hear is a healthcare professional would be answering questions or talking about the work or research or study he has done and his findings, all those details. And the duration of each audio is about 4 to 5 minutes. And the question type that you get in listening part C, it is again similar to part C. You get multiple choice questions with 3 options. And you have 6 questions for each audio extract. Based on each audio, there are 2 audio recordings that you will be hearing in part C, and based on each audio, you will have 3 option multiple choice questions. And the preparation time. Before each audio begins, you will get 90 seconds to prepare, okay, to go through the question, understand what are the different questions, what are the different options. For this, you get 90 seconds. So for one whole extract, you get 90 seconds. Unlike listening part B, in part B, you had 6 different extracts, and for each extract, you got 15 seconds to prepare. But here, for the entire extract, for one whole extract, you will be getting 90 seconds to prepare. Now, let's understand what skills are being tested in part C of listening. So, what are they trying to assess by making you do part C of listening? So, they are trying to test your ability to understand the gist. The gist means the summary, whatever you're being heard. So, whether you're able to understand the main idea of what you're hearing. That is one area that would be tested. Then opinion and attitude. So whether you're able to understand the opinion and attitude of the speaker, that is what the speaker thinks or feels, whether you're able to understand that from the audio, that is another area that would be tested. Then they might also look for a specific detail. Apart from this gist, they would also be looking whether you're able to understand a specific detail from the audio that you hear. So these are the areas that would be tested. Okay. Now, let's see how part C question paper would look like. How will the questions be like? So the first thing that you have to understand is you need to understand the context during that 90 seconds of preparation time. What you need to understand, the first thing that you need to understand is you have to understand the context. Now, what do you mean by understanding the context? So the first thing that you need to identify is what is the speaker's profession and on what topic he is going to talk. So here you can see from this contextual information, you can see that you hear an interview with a cardiologist. So the speaker's profession is clear. You're going to hear a cardiologist talking, and a cardiologist called Dr. Jack Robson, who is an expert on Chagas. So you're going to hear a talk on this Chagas disease. And then another thing that you need to understand with regard to the context is that whether it is a presentation or an interview. So that also you can get from here. You hear an interview. So why are we actually identifying this context? That is, we need to understand the speaker's profession and topic, how it is going to help us. So when you understand that it's a cardiologist, you're going to listen to a cardiologist and he's going to speak on Chagas disease, you can actually activate your background knowledge regarding the speaker and the disease if you know. So you're actually getting prepared to what you're about to hear. If you already have some idea about the Chagas disease, it will actually help you. And when you know you are going to listen to a cardiologist, then you can have guesses on what kind of details he might be discussing in the audio depending on the speaker's profession. So that's why it is necessary that you have an understanding on what is the speaker's profession and on what topic you're going to hear in the audio. Actually, you're making yourself prepared, getting into that zone before the audio begins. And then why you need to identify whether it is a presentation or interview. So if it is an interview, you can be sure you will be hearing two different voices in the audio, the interviewer's voice and the interviewer's voice. But if it's a presentation, you have to be more cautious here, or you have to be more alert. You'll be hearing only single voice, and from that you have to figure out things. So that differentiation you have to have before the audio begins, again to make yourself prepared for the audio. So these are the things that you have to do in prior before the audio begins. And the question will be like this. It will be mentioned you have 90 seconds to read the questions 31 to 36. You'll have 6 questions, and with each question having 3 different options. Okay. Now, I would like to talk about keywords in signposting. Keywords, like while we had discussed, we had this video on part A, listening part A and part B. I've already mentioned about the use of keywords. So keywords are nothing like those are words that will help us in identifying the answers. So understanding the keywords is really important even in part C. That will actually help you in guiding. It will actually help you in guiding through the audio. Okay, so here also in part C also you need to underline the keywords so that you can track the audio. And another thing is that you should not be expecting the same words, the keywords that you have underlined in the question paper, you should not be expecting the same words will be heard in the audio as well. You should be ready for synonyms, the words similar to that or which has the same meaning as what you have underlined in the question booklet. Are most probably to be heard in the audio. So understanding the keywords is the first thing when it comes to part C as well, to track the audio and to understand where the audio has reached and also to help you in finding out the answers. Then another thing is signposting. Now what do we mean by signposting? Signposting also helps us to actually track where the audio has reached or actually to understand the logical flow or sequencing of the audio. Now what do you mean by signposting? I'll show you some examples or common categories of signposting. Now if the speaker is introducing a topic, then you might probably hear words, phrases like today I would like to talk about. So you understand that that's the introduction of the talk. Or else you might hear something like let's begin with. So you understand that it's the beginning. Then if it's a transition from one idea to another, you might hear something like now let's move on to, or another important aspect is. So here you understand that there's a transition from one idea or from one point to another. Now if the speaker is giving examples, then you can expect phrases like for example, or to illustrate this, or for instance. Such phrases will give you a hint that or will make you understand that the speaker would have explained or talked about something, and based on that now he is going to give an example. Then contrasting information. If the speaker has spoke about something, a benefits of a specific aspect, and now he is going to talk about the negative aspects of the same. So there is a contradiction or there is a contrast. So such contrast will be marked by words like however, on the other hand, in contrast. So when you hear such phrases, you have to be ready for hearing the opposite of or the opposite aspect of what you have heard so far. And then emphasizing key points, like if the speaker wants to stress on a specific area or a specific aspect, he might be using phrases like it's important to note that, or I would like to highlight, or what's crucial here is. So when you hear such phrases, you understand that that is an area where the speaker is trying to stress on or emphasize on. Then when the speaker is trying to summarize on the idea, you might hear things like to sum up, in conclusion, overall, we can see that. So this signposting, as I mentioned earlier, it will help you in tracking the audio, specifically when it is a presentation. When it is an interview, you can understand the transition from one question to another question when you hear the change in voice. When you again hear the interviewer's voice, you understand that, okay, it's time for us to focus on the next question. But in presentation, it's a monologue. You just hear only a single voice. So you really have to be on your toes. So to help you in that, the signposting will help you. Now you can look out for, or you can listen to such phrases which will actually help you where the audio has reached, or while the speaker is moving from one idea to another, you can actually focus on the next question, because moving on to a next idea can be probably in the question booklet, there can be a chance of moving from one question to the next question, or else there might be a question asking for what did the speaker emphasize on. Then if that is the next question, then you can actually check, or you can actually be alert for such phrases to see if you are listening such phrases like it's important to, or I would like to highlight, or what's crucial here. So you have that actually helps you in finding out answers to certain questions and also in actually guiding you through the audio. So that's about keywords and signposting. It will help you in tracking the audio and narrowing down to the right answer. Okay. Now let us do an example and see how it works. Okay. Now you can see the question and the options on the screen. Now the context is the same that I've shown you before. You are going to listen to a cardiologist, Dr. Robson, who will be talking about Chagas disease. Okay, so that you already understand from the contextual information. So I've already shown that in the previous screen. Now the first question that you need to answer here is, why does Dr. Robson regard Chagas as a neglected disease? So you'll be doing this analysis during the 90 seconds of preparation time. So what are the things that you should be doing during that 90 seconds? You've already understood the contextual information. You'll be listening to a cardiologist about Chagas disease. And now moving on to this very first question, what is it that you have to find out? Here you're asked to state or find the reason why does Dr. Robson regard Chagas as a neglected disease. So the keyword is neglected disease. Now, what do you mean by neglected disease? A disease which is not considered seriously or ignored. That's what you mean by neglected disease. And you have to find out what reason why Dr. Robson considered this as a neglected disease. Now, what are the options? The first option says that doctor considered it as a neglected disease because of the social groups it mainly affects. Maybe it is happening in a social group which is, a backward kind of group which is not receiving any benefits. So maybe a marginalized group. That is the reason why it is being ignored or neglected. Is that the reason? Or the second option says that because patients often don't realize they are infected. Is that the reason? The patients, once they are actually infected, they don't realize it. They realize it only at a later stage. Is that the reason why it is considered as a neglected disease? Or option C. Option C says that its impact is severe in a relatively small number of cases. Is that the reason? That is, the effect of this Chagas disease is not that severe in most of the cases. In majority of the cases, it has severe impact only in relatively small number of cases. Is that the reason why Chagas is considered as a neglected disease? That is what you need to understand from the audio. So once again, I'll recap the meaning of the options that are given here. Is it because it happens in a specific kind of social group, or is it because the people are not able to realize that they have been infected with this disease, or is it because the severe impact of this disease happens only in smaller groups? Okay, so we have an understanding of the meaning of the options, and we also need to see what are the keywords that are appearing in the next question so that we understand the transition. So in the second question, what does it say? Dr. Robson says that concerns over Chagas in the USA are the result of. So he's talking about the concerns of Chagas in USA are the result of. So because of what? Because of. Why is Chagas in USA is concerning? Why is it? What is the reason for that? That is what this question asks. Dr. Robson says that concerns over Chagas in the USA are the result of. What has caused this concerns over Chagas in the USA? So that is how you'll have to identify the transition. You have to look out for words like concerns and USA. Okay. Now shall we listen to the audio and try figure out the right answer? Let me play the audio.
Today we're talking to Dr. Jack Robson, a cardiologist and Chagas disease specialist in the USA. Dr. Robson, what is Chagas disease and why is it referred to as a neglected disease?
Chagas is caused by a parasite called Trypanosoma cruzi. Most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, which carries the parasite.
Right.
People often don't realize they've been bitten, and during the initial phase of the infection, symptoms are normally mild or absent.
Okay.
70% of those infected never develop complications. For the other 30%, the disease tends to remain silent for a long time, often 30 years, but it eventually enters a chronic phase characterized by serious cardiac, digestive system, and neurological disorders. About 7 million people worldwide are thought to have Chagas, but it attracts relatively little publicity or funding for research. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where it's endemic. You need resources to force significant action.
Right, I see. And are there any concerns in the USA about Chagas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states.
Okay, now that you have listened to the audio, so one thing that you would have noticed is that you could hear aspects from the audio which are actually pointing towards all the three options. But is it actually justifying the question? That is what is more important. Now, regarding the first option, because in which the keyword that we identified was social groups. So something related to social group. You heard something like marginalized community, and then when it comes to option B, like the speaker is also saying that people don't realize that they are infected with Chagas disease. That is also heard. Then option C, he's saying that like the impact is not that complicated or it's not that severe. So the ideas from all of these three options are heard in the audio. Now what decides the right answer is the question. Why is Chagas considered as a neglected disease? That is, we have to find answer to that question. So for better understanding, I shall also show you the transcript. Now, the speaker says that people often don't realize they have been bitten, and during the initial phase of infection, the symptoms are normally mild or absent. Okay, so which means that you hear this aspect and this aspect as well. That is, the speaker says that. So you hear in the audio the speaker saying that people often don't realize they have been bitten. So that fact is said, but you cannot hear the speaker saying that that is the reason why it is considered as a neglected disease. Just it is being mentioned in the audio. Then another thing, it is also said that 70% of those infected never develop complications, which means the severity is not that great. So even when it comes to option C, you hear that, but again here also the speaker does not say that that is the reason why it is being considered as a disease which is neglected. Then moving forward, you hear the speaker saying that about 7 million people worldwide are thought to have Chagas, but it attracts relatively little publicity or funding for research. Despite the fact that a lot of people are or have this Chagas, it does not receive that publicity, or funding for research is not available. And then he says that this indifference, now what do you mean by the word indifference? Indifference can again be related to this word neglected. It has the same meaning. This indifference means ignorance. Okay. So now he is coming to that point. This indifference is largely due to. So here we are going to get the answer for why. Why is this indifference? So this indifference is largely due to it being primarily a disease of marginalized communities in Latin America, where it is endemic. So he says that, very clearly says that this indifference or this negligence or ignorance is due to, is why he's saying, he's stating the reason. Because this disease is endemic, it is specific to which region? It happens in the marginalized communities in Latin America, which means that he says that it is because it is occurring or happening, or it is endemic to a specific group, social group. That is the reason why it is being neglected. So we conclude the right answer here is option A. Now let's move on to the next question. Okay, now let's have a closer look at question number 32. In 32, what are we supposed to find out? Dr. Robson says that concerns over Chagas in USA are the result of. So what is the reason for concern regarding Chaga in USA? What is the reason, are the result of, what is causing the concern over Chagas in USA? Now, as per option A, what does it say? A rise in the number of people at risk of being infected with the disease. A rise. So are they talking about an increase in the number of people at risk of being infected with Chagas? Is that the concern? Is that the concern? Or the option B says that a greater awareness of how many people there have the disease. A greater awareness. So knowing the fact that a lot of people, or how many people there in US already have this disease. Is that awareness causing the concern? Or option C, an increased prevalence of the insect which carries the disease. Is it because of the increase or the widespread prevalence of this insect causing Chagas is causing the concern regarding Chagas in the USA? So these are the three different options. We have identified the keywords in each of these options. And now let's listen to the audio.
Primarily a disease of marginalized communities in Latin America, where it's endemic. You need resources to force significant action.
Right, I see. And are there any concerns in the USA about Chagas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the benefit of our listeners, can you describe an individual case?
Well, this year, a Bolivian woman.
Okay, now that you have listened to the audio, were you able to find out the right answer? Here also, you can see the mentioning of insect, then you can hear the words like infected. All these things are again being heard here. Now here, what we actually wanted to find out, what was the concern over Chagas in the USA. Now I'll show you the transcript, which will make things clear. So yes, the speaker asks this question. Are there any concerns in the USA about Chagas? And then the cardiologist starts speaking. Yes, the insect carrying the parasite is actually endemic to the southern US states. However, no more than 30 people have been bitten and infected while in the USA. So he says about that the insect carrying this parasite is endemic to the southern US states, but he says that however no more than 30 people have been bitten and infected while in USA. So it's not mentioned as a concern that, or it is even not mentioned that there has been an increased prevalence of the insect. He just says that this insect is endemic to southern US states, but like no more than 30 people have been bitten and infected while in the USA. So that this insect related option is not the right answer. Then what does he say? The alarming thing. So alarming thing, when you hear this phrase, definitely we need to be more alert here because the question asks about concern. So the alarming thing though is that it's become apparent. Now what do you mean by apparent? Apparent means it's clear. And here in option B, we have something like greater awareness, which again means being clear. Okay, so it's become apparent that large number of first generation and some second generation immigrants from Latin America carry Chagas, around 300,000. So what the speaker is saying, that the alarming thing or the shocking thing or the concern is that it is apparent, it is clear that, or we are now aware that a large number of people who are immigrants from the Latin America already have this Chagas, which means that it matches option B, which says a greater awareness of how many people there have the disease. So from here itself we can conclude that option B is the right answer. And then he adds on something, these people won't infect others. So even though this many people, 300,000 people are already infected with Chagas, but they don't pose a threat, which like option A says that a rise in the number of people at risk of being infected. Despite the fact that 300,000 people are already infected, they will not infect others. So option A can also be ruled out, and we can confirm that option B is the right answer. Now that we have analyzed two questions from an interview perspective, now we'll try just one more example from a presentation. Okay, now you can see the second type of question that is based on a presentation. Let's read the contextual information. You hear a microbiologist, so you understand that the speaker is a microbiologist called Dr. Jane Finn giving a presentation. So you have to be more careful. You will not hear change in voice. It will be a monologue and you have to be more alert here. A presentation about the overuse of antibiotics. So the topic of discussion is overuse of antibiotics. So the one thing that we have to be extra careful when compared to presentation is that we will not be hearing that switching over of voice. So how do we identify the transition from one question to another question is we have to look out for signposting, and we also need to watch out for keywords. Okay, so first let's identify the keywords from questions 31 and 32, and we also need to understand the meaning of the options and also what the question is asking for during the 90 seconds of preparation time. So as per question 31, what you need to find out, what reason. So you have to find the reason of what reason does Dr. Finn give for the rise in antibiotic use, in the decade to 2010. So question 31 wants you to find out the reason for the rise in antibiotic use during the 10 years time from 2000 to 2010. Now what are the different options? Option A says that the ready availability of the drugs online. Is it because the drugs were easily accessible online? Was that the reason for the rise in antibiotic use? Or option B says that the time pressure that the doctors were working under. Is it because the doctors had a lot of workload that carelessly sometimes they prescribed these antibiotics? Was that the reason for the rise in antibiotic use? Or option C, option C says that the fear felt by doctors for failing to treat possible infections. Sometimes the doctors might have felt that just in case if they don't prescribe the antibiotic, they might not be treating the patient rightly. So to avoid such a possibility, they might have prescribed these antibiotics. Was that the reason for the increase in the use of antibiotics? So again, you should be open to synonyms for words like rise. You might hear something like increase. We don't know. So I hope it is clear. What we need to find out as per question number 31 is the reason for the rise in the antibiotic use in the decade to 2010. Now we also need to find out how we can identify the change or transition to the next question. What reservation does Dr. Finn have about a recent fall in the number of antibiotics prescribed in the UK? So the entire discussion is about antibiotics usage. So it's not necessary that we have to underline antibiotic. Now, as per question number 32, what we need to find out is that what reservation means, what concern or what doubt does Dr. Finn have about a recent fall. Recently, there had been a decrease in the number of antibiotics prescribed in the UK specifically. So what concerns or doubts does Dr. Finn have about this? That is where you have to understand that the question, the audio has reached to the 32nd question. Okay. Now I'll play the audio and let's see whether we are able to find out the answer.
My name's Dr. Jane Finn and I'm a microbiologist. I'm talking today about the overuse of antibiotics, or antimicrobials as they're often called, and the serious dangers this poses for the future. We're all familiar with the threat of a post-antibiotic era in medicine. But how did we get to this point? Well, in the decade up to 2010, we saw a staggering increase of 36% in antibiotic use worldwide. As more and more global citizens were able to access them, usually online, we saw uncontrolled consumption during that period. Although recent media stories suggest the general public has finally got the message that antibiotics should be used sparingly, there's still a hard core who want them prescribed for everything. Doctors are now better at resisting their demands, however, for example when the problem's viral rather than bacterial. This has improved things. For instance, there's been a fall recorded in the overall amount of antibiotics prescribed in the UK in a given 4-year period. At first sight...
Okay, so I think this was pretty easy. It's very clear from the audio that the reason for the rise in antibiotic use was this ready availability of the drugs online, and we have not heard anything regarding the time pressure that the doctors had while working being mentioned in the audio, or the fear of the doctors. Of course, there's a reference to doctors, but nothing has been mentioned regarding the time pressure or their fear. Anyways, I'll show you the transcript. So here the speaker says that, talks about in the decade up to 2010. So we understand that we are getting on to that point, that is the question in question number 31. That is, in the decade up to 2010, we saw a staggering increase. So staggering increase is what has been paraphrased into rise in the question in antibiotic use worldwide, as more and more global citizens were able to access them usually online. So access them means it was available online. So it is very clear there that the right option is A. But just to ensure that option B and option C are not the right answers, let's read through the rest of the transcript. We saw uncontrolled consumption during that period. Although recent media stories suggest that the general public has finally got the message that antibiotics should be used sparingly, there is still a hardcore. And coming to the reference to the doctors, here they are mentioning doctors are now better at resisting their demands. They're just saying that now doctors resist prescribing antibiotics. Maybe they used to prescribe earlier, but it's not mentioned that it's because of their time pressure or because of their fear. No such references have been made. So we can easily rule out option B and option C. And then they are coming to the 32nd question, and during the transition you would have noticed this. For instance, which means that now the speaker is going to illustrate an example. For instance, there has been a fall recorded in the overall amount of antibiotics use prescribed in the UK. So they are taking UK as an example to describe it. Okay, so now we have gone through a question from the presentation, and we have also looked at questions from interview. I hope the examples were clear to you. We have listened to a presentation and we have listened to an interview, and we understood how to approach the questions, how to tackle the situation. The first thing that we need to do is we have to understand the context so that we can make ourselves prepared for what we are going to hear. We need to understand the profession of the speaker, we need to understand the topic on what we are going to talk about, and then we need to have a clarity on whether it is a presentation or an interview. Then you need to closely observe or analyze the question, the meaning of the question and the meaning of the options. Then underline the keywords, and you should prepare yourself for listening to the synonyms of the same. Hope you found this video on listening part C helpful. We'll be back with more such videos. Stay tuned. Thank you.
Medcity International Academy. Trusted hands forever.